Okay. So today we started with the any eye problem or eye issue for the over-the-counter product. Okay, so we first started with one case. So Mr. Wang's wife come into the pharmacy and just say she feel gritty dry eye. 什么是 gritty 哈 ？gritty 在中文你可以解释是有一点像是好像有眼睛有那种沙粒那种异物的感觉 ，so we call it gritty. So when you feel something like inside your eye that make your eye uncomfortable, then we call it gritty. Gritty. Then you feel gritty and dry for both eyes. And this lady, Mr. Wang's wife, asked if you can recommend anything. So first, what question would you ask? Okay. So maybe everyone can ask a question. Maybe we start with Qian Yu.
好，老师好，我是千羽。我会想要问他有没有戴隐形眼镜的习惯。
对，有这个也很重要。好，第二个，怡莹，你会问什么问题？
我会问他有没有用药过敏，或是
Yeah.
有没有用药过敏这样。
Yeah. So allergy. 好 ，Tahira 呢 ？What question would you ask?
Sir, I will ask from how long she is facing this situation,
Yeah.
and like from how long, and what are like is there any dust allergy or any kind of allergy, or is anything get into her eyes, or getting itching or allergic symptoms like this?
Okay. So check still allergy and also how long have they had the symptom? 好，我们请吴玉福。
我会问他是有没有其他的症状，是眼睛有没有个感觉是痒痒的。
So itchy itchy eye or something. 俊华都被问完了，所以你这一题最难问的。
会先问他的过去病史，然后
过去的病史，例如什么？比如说可能有什么糖尿病、高血压，
对，或者他就有什么青光眼，或是他本来就眼睛可能不太。
So just ask the patient's past history or medication history. See whether the patient had glaucoma or what medication, medical condition. Okay. Okay, the next question. So, yeah, I think you all complete nearly all the question. The first, taking any other medication. Why? Because some medication can cause dry eye, like anticholinergic. Because one of the side effects for anticholinergic is dry eye, and diuretic, yeah, one of can cause dry eye too. And steroid. What can steroid do? Yeah. Steroid can increase the eye pressure. So for people having the glaucoma 青光眼，这个类固醇可能会让这个眼压升高。Okay, and the second is see whether they wear contact lens. Because sometimes can be because they have very bad habit for cleaning their contact lenses. And also some when you need to recommend any eye drop, most of the eye drop they have preservative in it. So preservative can damage the context. So that's why you have to ask, do you wear contacts? Do you wear contact lens? 有没有戴隐形眼镜？因为这个很多的这个防腐剂呢，它会跟这个隐形眼镜的这个材质结合所以会造成可能眼睛会有刺激所以要问看看有没有戴这个隐形眼镜。Okay, the next question is there any pain? Because pain is a like a very bad sign. Yeah, if they feel pain, then you might have to consider refer this patient. So pain is always a issue to refer the patient. Okay, or any like their vision change, or they can see things clearly, or you can see any foreign body. Okay. So because for any pain that might indicate patient's got glaucoma or iritis or any cornea ulcer. You know, when you have the ulcer, it's very painful. 所以当你有这个角膜的这个 ulcer， 角膜的溃疡呢，通常是很痛很痛的。所以当病人有这个角膜的溃疡，这个时候when patients got ulcer in their eye, normally the eye drop is very hard to cure this problem. So you have to refer them to the doctor. And the next one is any discharge or pus from the eye? Okay, so when it's come to the discharge, we have to ask whether what is the discharge? Is it look like watery, or is a bit creamy, white color or yellow color? Because the creamy color, yellow color may indicate there's a bacterial infection. And watery color sometimes can be caused by virus, or sometimes can be allergy. Okay, and also you ask whether they have any medical condition, diabetes, or any allergy, or arthritis. Why we ask arthritis? Because here we have a syndrome called Sjogren syndrome. Sjogren syndrome is something to do with arthritis. And Sjogren syndrome is, we're going to talk about that the next slide. Okay, it's something can cause dry eye, dry mouth. Yeah. Or if only one eye is affected, one eye affected. 所以各位同学，如果你们在药局里面看到有一个病人进来，他的眼睛只有一个眼睛不舒服，跟两个眼睛不舒服，哪一个会比较严重？ So when you see a patient coming into the pharmacy and complaining, they feel both eye not feeling good, or one eye, which one is safer to treat? 问一下各位同学，有没有？所以一个眼睛有问题的比较危险，还是两个眼睛有问题的比较危险？
感觉一个眼睛的比较危险。
对，在这边的我们这边刚开始我去上课的时候，这边的医生或者是这个老师就说，遇到一个眼睛尽量要考虑可能要把它叫 refer 转给医生因为两个眼睛通常代表什么？两个眼睛的问题通常是代表什么？ When two eyes involved, normally it indicate allergy or dry eye. So for those issues, you can recommend any lubricant eye drop. 所以当你两个眼睛有问题的时候，通常表示都是什么问题？通常都是什么干眼症或者是有过敏，会造成眼睛痒，这个时候都是两个眼睛有症状。那这种情况我们在药局可以治疗的。可是如果只有一个眼睛呢，通常代表什么？ So when only one eye is involved, normally indicate there's a infection or there's a pain or any inflammation for the eye 或者是glaucoma one eye can be happen so one eye is tricky than two eye okay so let's talk about dry eye today because dry eye is something pharmacists can treat in the pharmacy so normally the risk factor for the dry eye is okay people over 50 years old and the second is they post menopause 所以停经或者是停经后的妇女他们因为激素的缺乏所以他们容易有干眼的问题 The third one is aircon So when people they stay in the air conditioned room for a long time or a windy day, sometimes windy day mean they can the wind can take away your moisture in the eye, so they can cause dry eye. And the fourth one, have they been reading or studying because they have an exam? So they're using their eye with their eye open for a long time. So that's the reason causing the dry eye. And the third one, one of the reason causing dry eye is they wearing the contacts. Yeah. And the last one, Sjogren syndrome. Okay. For example, people, if they have rheumatoid arthritis, 就是类风湿性的关节炎的时候。通常如果他又有干眼症的时候这些都是 Sjogren syndrome 它是is one of the we call autoimmune 一种自体免疫的问题所以下次你们可以留意有病人有干眼症他们是不是有一些病人是跟他们的风湿疾病有关的有时候你会发现这样子的病人Okay, so what is Sjogren syndrome? It's a autoimmune disease, and also because your immune system attack the eye, the saliva, the gland, 因为它会攻击眼睛的那个泪腺的分泌液的那个组织，还有这个 salivary gland， 就是你的口水的分泌的组织or can be any part of the body. So that's why they causing the syndrome like dry. When they attack your salivary gland, so you have the dry mouth. When they attack the gland inside the eye, it causes dry eye. Okay. So at this stage, there's no cure. So this condition can only be managed by artificial tear or saliva or mouthwash or lozenge just to keep the moisture in the mouth or for the eye. Okay, so that's the diagram for what's the syndrome. Yeah, you can see. You can have a look when you have time. So we're not going to talk too much about this Sjogren syndrome, but you might come across this Sjogren syndrome later when you practice as a pharmacist. Okay, so let's talk about what's the structure for your tear. Okay, so the structure for the tear is like a film, but this film has 3 layers. The first layer is lipid layer, and the second is aqueous, and the third layer is mucus layer. Okay. So if one eye drop can mimic that structure of the tear, that would be the best tear drop, ear drop. 所以这个眼泪，我们人体的眼泪的结构呢，分为3层。 所以如果说有一种眼药水，它的这个可以做到很接近这种泪液结构的这种情况，那它的效果就会更好，因为它的保湿的效果会很好。So from the structure of the tear film, you can see the outer there is lipid. So lipid actually is a barrier to protect too much moisture to be evaporate from the eye. 所以这个脂质层呢，它基本上可以保护我们的泪水，可以在减少它的好像被蒸。如果没有这个脂质层、脂肪层的话，我们的泪水可能很容易就一分泌出来就干掉了。Okay, so the first problem disease you probably will see is conjunctivitis. Conjunctivitis 中文叫做结膜炎，对，所以我们要考虑什么叫做结膜炎。Okay, so we still start with a case. So Mr. Wang, so this time is his son just woke up in the morning and just found his right eye was sticky and a bit yellowish discharge. 所以老王的儿子早上醒来，他发现右眼黏黏的睁不开，有轻微黄色的分泌物。So from what we mentioned just before, yellow color discharge normally indicate there's a bacterial infection. 所以这个 case 它就是有这个可能就是一种细菌性的结膜炎 ，is bacterial conjunctivitis. Okay, so normally, if patient or people having this problem, normally the yellowish discharge will start with one eye. When they wake up in the morning, they'll feel a bit sticky for their eye, and sometimes it's because it's stiff, so they can't open their eye. So normally that indicates there's a bacterial infection, and maybe later they'll become two eye because can pass from one eye to the other. So this diagram 就这张图呢，就是要来解释说什么是角膜。So this diagram just trying to tell you where is conjunctiva. Conjunctiva 就是角膜。So you can see that red area. See that red area, and here red area. This is what we call conjunctiva. 所以是角膜，这就是角膜的位置。所以我们说角膜呢，它实际上是在这些红色的这个位置产生细菌感染或者是发炎的状态，而不是我们这个前面，我们这个前面叫什么？前面不好意思，我说错了，这个是conjunctiva 是指的是结膜，结膜是指的是什么？这个 red area。然后角膜呢？角膜指的是前面这个我们这个外面的这个眼睛这个部分，这个地方叫角膜。So you have to distinguish which one is cornea and the other one is conjunctiva. 所以你们要分辨角膜炎跟结膜炎是指的是不一样地方的发炎。So this diagram is in English. So cornea, so see, this is cornea, the blue area, cornea, and conjunctiva is 就是这个地方 red area. So they are different area. Conjunctivitis, so normally is inflammation of the transparent membrane covering the red eye. Okay, so The causes for conjunctivitis, there are three. The first one is bacterial, and the second is viral, and the third one is allergy. 所以造成我们的结膜炎，结膜炎有3个原因。第一个就是所以细菌，第二个病毒，第三个是过敏性的角膜炎。所以我们在药局，我们要去了解这3种的差别是什么啊？虽然说在目前台湾的药局是没有办法治疗这个 bacteria 还有 viral 的这个部分啊，但是台湾的药局可以治疗的是什么？过敏，应该是可以吧？因为台湾的药可能过敏的这个部分，那个眼药水可能是可以稍微去治疗。So I think in Taiwan's pharmacy, bacterial and viral issue, we can't treat them. We have to refer to them to the doctor. But for people having allergy issue, allergy conjunctivitis, we can do something. We can offer them the eye drop to stop the itchy, stop the allergy, or taking the tablet, antihistamine to stop the allergy. Okay, so the first is bacterial conjunctivitis. Normally, it can be, okay, the symptom is like gritty, a little bit red with discharge, and it's yellow colored discharge, just like this photo. See this image, similar, yeah? And sometimes it's not just gritty, sometimes can be painful, okay? And normally the infection started with one eye and then pass to the other eye in 1 or 2 days. And normally it's mild, and if you don't do anything, the problem probably will go away within a couple of days. Okay, and you can use what can you use them without using antibiotic eye drop? You can recommend the normal saline wash just to clean. You know, for the baby like 1 year old or under 1 year old, normally doctor wouldn't recommend any antibacterial eye drop. So normally they would start with any eye wash with normal saline. 所以在药局，我们我刚刚说这个细菌性的结膜炎，我们原则上大部分都是转给医生，因为我们没有办法使用这个处方这个 antibiotic 的这个眼药水，但是在澳洲是可以的。澳洲这个药是属于 OTC 的药，所以我们只要确定病人是有这个问题，我们就会给他这个药啊。Okay. So, and the symptom for the bacterial conjunctivitis, sometimes they can feel sensitive to the light, and it's also contagious. 它会传染的, and most of the time it's more like in children than in adults. Okay, so we can use eye drop or ointment. Yeah. And the second is viral conjunctivitis. Okay, you know, virus can cause cold, flu, sore throat, and sometimes it can cause conjunctivitis. Yeah, if people having the cold and flu maybe a couple of days before, or sometimes might not be, maybe alongside the whole disease. Later, like a couple of days later, they probably will be having some viral conjunctivitis. And it's the same. You start with one eye and pass to the other eye in a few days. And here is highly contagious because it's virus. Okay. And normally, if you don't do anything, the problem will clear up in 1 or 2 weeks. Okay. And normally the discharge, as we mentioned, for the bacterial conjunctivitis, the yellow color is the bacterial. And normally for the viral conjunctivitis can be either clear or a little bit clear, but you won't see yellow color. And then what is allergy conjunctivitis? Okay, so normally the common symptom is they feel very intense itching for the eye, and they like to rub the eye because it's pretty itchy. And normally because after they keep rubbing the eye can be very red. And it's watery and white mucus discharge. And you can see the eyelid is a bit swollen. 所以从这个地方，它跟病毒的那个分别是什么？过敏性的这个结膜炎呢，它是症状就是一个字叫做痒，很痒啊，它跟病毒的差别。So to differentiate between allergy conjunctivitis and viral conjunctivitis is itchy. Allergy conjunctivitis very itchy, but for the viral, it's not that itchy. And you can see the discharge are similar, the watery or a bit white. Okay. And for the allergy conjunctivitis, sometimes you'll see it's a bit swollen eyelid. Okay. So what can we treat for the conjunctivitis? The first, in the community pharmacy setting, is normal saline irrigation. 使用生理水来冲洗。Now, the second is we can try to offer the antibiotic eye drop or ointment. But normally, in Taiwan, you need to refer. But in Australia, we can just tell them, okay, use for 2 days. If not helping in 2 days, please see your doctor. Okay. And the third one, very important, we have to explain how to use the eye drop and ointment. So this is very important. When you supply the eye drop or ointment, you got to tell your patient how to use it. Okay, we will talk about that later. And also, can they wear contact? No. When you are treating the conjunctivitis, doesn't matter it's viral, bacterial, or allergy, we will recommend then don't wear any contacts. Okay. And if you decided to treat them without referring to the doctor, just be aware the 2 days rule. Not helping in 2 days, see your doctor. Okay. So 这张图是解释说结膜炎跟角膜炎两者的一些症状的不同。So this diagram is to differentiate the conjunctivitis and the other one. What's the difference? 所以你们可以自己看一下我们这个地方不会做太多的介绍。Okay, and the next one is stye. Stye 在我们中文可能就是叫做长针眼啊，对，或者叫做什么麦粒肿。所以一般如果长针眼，一般就是什么？它是一种细菌，它的那个睫毛的这个是the eyelid, the gland to produce the lipid is infected. So normally there's a swollen and pus comes out, and sometimes can be pain and red and itchy. But you probably had the stye before. How do you treat it? If you don't treat it, it probably will get away after a couple of days. But if you treat them, it would shorten the whole disease, maybe from 7 days to 5 days, 4 days. Okay. 所以这个针眼呢，通常你们可能有些人都有得过基本上它需要的只是这个抗生素的这眼药水或者是软膏但是如果你不去治疗它，它自己也是会好的但是你通过治疗只是让它加快。另外一种我们会建议就是在如果你长了这个针眼的话，我们会 叫他用这个热毛巾去see this one the style is bacterial infection. Normally we will recommend normal saline irrigation or hot towel compression. 就是你通过敷这个热毛巾，它会增加那边的血液循环，那它也会让它好的比较快一点，但是一样，如果2天内没有比较好，请病人要看医生。So after 2 days, if they are not feeling better, see the doctor. Okay. How to use eye drop? 所以这一点很重要啊。Doesn't matter. 我现在不管你们是要用英文解释我想这个我觉得是一个很重要的，我们可能不一定在我们当药师的时候都会学到The first one is, definitely is wash your hand and normally tilt your head back， 就是把你的头呢往上，然后看着天花板，往上看，然后这个时候呢，当 with your eye open, gently pull down lower eyelid to form a pouch， 就是你把你的下眼睑呢，把它拉下来。然后形成一个什么小小的一个眼袋的一个空间，然后呢，你就把那个 eye drop 放在你的眼睛，滴在那个眼袋，然后呢，然后再眨眼睛。So, instill one eye drop into pouch, but do not let the tip of the dropper or the tube touch the eye or eyelashes. 所以不要让你的眼睛那个眼药水的那个顶端去碰到我们的眼睛，因为这样子可能会造成什么？造成污染Then close the eye, try not to blink for a short time. 就是点下去了以后，不要马上眨眼睛，我们让这个眼药水呢跑到整个眼睛以后，这个时候我们再把眼睛眨起来，因为你眨眼睛的时候呢，那个所有的这个眼药水通通会流出来。所以效果会打折，所以为了让这个眼药水达到最大的效果 ，they need to once they instill the eye drop into the eye, keep the eye open for a while before they close the eye. OK， 但是有另外一种点眼药水的方法，因为有些人不太会点眼药水，他们很怕点眼药水，因为他们或者是点的不准，或者是什么小孩子你要给他点眼药水，他乱动，他也不让你点眼药水，那怎么办？有一个办法就是让他们把眼睛先闭起来，然后闭起来的时候，你就把那个眼药水呢滴在他的眼睛的这个角落这个地方，然后当他把眼睛说你可以把眼睛睁开了的同时，那个眼药水就会跑到整个这个眼睛。So this is one of the other way of doing the eye drop, especially for children or for people having problem to to put the eye drop into their eye. They can do it with the eye closed and just put the eye drop at the corner of the eye, put 1 drop or 2 drop, and then open the eye. And when you open the eye, eye will draw those eye drop into the whole eye. So for people like having issue or for kids, they can use this method to do the eye drop. OK， 所以这个是图就是 so just pinch your eyelid and form a pouch or pocket and put 1 eye drop, and then 它这个里有一个动作就是它把这个角落的这个地方按住这里我们知道角落有一个叫做有一个那个什么鼻泪管，是不是？我们把那个管把它按住以后，那个我们的眼药水可能才不会流到我们的鼻子里面。So when you close the eye and you press the inside corner of the eye, that can stop the eye drop from going into your your nose or your mouth. OK， 然后当然过多的眼药水我们就把它擦掉啊。所以各位去详记这个，这是属于你的病患咨询。如果在药局，不管是在药局或者是在医院里面，如果有病人拿的这个眼药水，你可以跟他解释怎么样去使用眼药水。你不会，你现在就不会说你回去自己点，对不对？有些人不知道，问你怎么点，那你这个时候就可以告诉他。Okay, then the next one is how to use eye ointment. Okay, so so the first 3 steps, 前面3个步骤呢，眼药的 for the eye drop is the same, but the 4th step is you squeeze a small amount of the ointment, roughly about 1 centimeter, and 1 centimeter, and put it in your lower eyelid, 你的下眼睑，你涂上大概1公分的这个眼药膏，然后 blink， 这时候你开始眨眼 ，blink several times to spray the ointment。所以当你开始眨眼的时候，这个眼药膏本来是在你的下眼睑里面，这个你开始眨眼的时候，眼药膏就刚好可以涂抹你的整个眼睛。So 如果 if the patient using the eye drop at a similar time of the day, so always use the ointment later. 所以如果病人他刚好是有2种有眼药水跟眼药膏的话，我们就是要使用哪一种最先？我们使用眼药水先，然后 ointment 是最后。因为 ointment 涂下去以后，我们的眼睛的那个就会有那个 blur vision， 就是那个就会眼睛会看不清楚啊。OK， 所以这个是我们的眼药水的部分。有没有什么问题 ？Any question? So that's for the eye drop. 好，
老师，我有一个问题。
请问，
就是老师刚刚在前面的投影片有介绍，就是眼结膜会畏光，就特别是细菌性的
其实不是只有细菌性，只要眼睛有任何的问题，比较大的问题，第一个反应都是畏光。畏光就已经代表是一个比较严重的问题。你通常眼睛不舒服、痒痒的，通常都还不至于到畏光的程度。如果到了畏光的程度，那就是表示什么？表示你的那个什么那个角膜，那个什么那叫什么？控制眼睛的那个什么？
瞳孔
已经那个反应能力已经变差了。因为通常我们人面对强光，我们那个瞳孔收缩会让眼睛不会觉得那么刺激嘛。但是你的瞳孔，你会畏光，表示这个瞳孔的这个东西已经有一点问题了。那瞳孔出问题，你觉得严不严重？比较严重。所以这种情况，就如果病人有畏光，可能就开始要想说这个会是比较严重的。
所以老师的意思是，就是只要眼睛有疾病，然后如果严重到会畏光的话，就可能都会畏光。那如果畏光就是一个比较严重的一个警讯的这样子。
当然不是说病人一定每个都要转给医生了，只是说还是我说那个所谓的 safety 的，你只要告知他就可以。你告诉他说我给你做这样的处理，如果你的情况还是没有好的话，那你要看医生。